Thank you for choosing the Brady Urological Institute and the Department of Urology at the Johns Hopkins Hospital for your surgery. We know you and your family and friends have lots of questions about your treatment and recuperation. This short video will prepare you for what to expect during your stay at the hospital. At Hopkins, we take a team approach to care after your operation. The communications board in your room lists the names of the people on your team. Our uniforms identify our roles. In blue is your registered nurse, or RN, who coordinates your care and medications and assesses your progress. In green is your clinical technician, or clin tech, who assists your RN, keeps track of your vital signs, helps you to walk, and much more. Our physicians, residents, nurse practitioners, and physician assistants all wear white coats. You might also work with a physical therapist or occupational therapist in maroon. And in purple, a phlebotomist, who specializes in drawing blood for your labs. Plus our hard-working unit associates in beige and black uniforms who do so much to keep our patients comfortable. And there's the Clinical Customer Service Representative, or CCSR, at the front desk, who greets your visitors and also answers the call bell beside your bed. When you call, the CCSR will alert your care team to your needs. At Hopkins, we are all about patient-centered care. Your team may include a case manager, pharmacist, social worker, and dietitian. We all will introduce ourselves and our role when we come into your room. But if you do not know who someone is, please feel free to ask.
My name is John. I'll be your tech for today. I'm here to take your blood pressure. Is that okay?
Another part of your care team is your own family and friends. One family member is welcome to spend the night in your room where there are sleeping options. Schedule. Our team is here 24/7, dedicated to your care. Because you have just had surgery, we need to monitor you carefully. Every 4 hours, we check your vital signs, including blood pressure, heart rate, temperature, intake from IVs and diet, and output from catheters and drains. You will need to take your medications, and phlebotomy may come to draw blood. Generally, your care team of physicians, residents, and others will see you between 6 and 8 a.m. when they make their rounds. There is a resident physician on duty at all times. There may be nurse practitioners and physician's assistants who address your needs as well. The communications board is a great interactive tool for keeping track of your goals for the day, pain medication schedule, and your target discharge date. We encourage you to use the board and write down any questions or concerns so we can address them. Postoperative exercises. Here's where you can get to work on your own recuperation. Doing these 3 exercises will speed your recovery and help make you more comfortable. First, dorsiflexion, or flexing your feet from the ankles. We also describe this as flip-flapping your feet. This increases circulation and helps prevent blood clots. This is good for you to do while you're in bed, and you should do this 100 times an hour while you are awake. Next, the incentive spirometer, which promotes deep breathing and helps keep your lungs clear. The incentive spirometer re-expands your lungs after surgery and helps prevent pneumonia. Suck in, hold, and then release. Do this 10 times every waking hour. Third, coughing and deep breathing. This also expands your lungs. You may need to splint your belly with a pillow as you do this to avoid pain after your surgery. Splinting helps hold your incision nice and tight while you cough and deep breathe. This will help reduce pain. Do your coughing and deep breathing exercises at least 3 times every waking hour. Blood circulation and walking. There is always a danger of blood clots after surgery, especially in your legs and hips. These 3 techniques help prevent that. 1. Wearing the compression sleeves while you're in bed. These sleeves compress and decompress around your legs, promoting circulation. 2. Sitting with your legs elevated to promote blood flow. We will help you out of bed and show you how to sit. It's best for you to sit in the chair in your hospital room with your legs raised. Sitting in this position is not only good for blood circulation, but it also helps prevent clots. 3. Walking, technically referred to as ambulation. This is one of the most important parts of your recovery. Your nurse or clin tech will help you with your first walk. We'll take that first walk slowly and carefully and adjust the distance as you are able. Your nurse will let you know when you can walk with a family member or friend. Walk at least 4 times a day while you're in the hospital. Pain management and medications. We will help you manage your pain after surgery. We use a pain assessment scale that rates pain from 0 to 10, with 0 meaning no pain and 10 being the worst pain you have ever felt. Keeping your pain under control is a key part of your recovery and will allow you to do your exercises and walk. Your nurse will monitor your pain tolerance and pain medication regimen. Our goal is that you can walk when you want to walk and sleep when you want to sleep. However, you may not have 0 pain at this time. Be sure to let us know if you are experiencing pain and your team will adjust your medications. Your nurse will review any new medications and potential side effects.
The purpose of this is it explains to you what the use of the medication is and any possible side effects.
As always, we encourage you to ask questions. Many patients take oral or injectable pain medication after surgery. Some patients have a patient-controlled analgesia, or PCA. With the PCA, you push the button to release pain medication. The machine controls the amount of medication you receive so that you cannot overdose. You control when you need the medication. Intake and output. Immediately after surgery, you will be hooked up to intravenous or IV fluids, which will help keep you hydrated. Your first meal after surgery will be a clear liquid diet. Next, a full liquid diet. Most patients progress to solid foods from there. As your diet advances and you take more liquids by mouth, we decrease the IV fluids and then stop them. Our team monitors both your intake of fluids via IV and diet, as well as the output through your urine and drains. Many patients have a urinary catheter inserted during surgery that drains urine continuously into a drainage bag. We keep a close eye on the color and quantity of your urine. Don't be alarmed if the urine is not yellow. It may be red, pink, or blue-green from dye used during your surgery. Bowel function. Return of bowel function, such as passing gas or having a bowel movement, is very important after surgery. Immediately after surgery, your bowels will be slowed, and you might not pass gas for a day or so. It might be several days before you have a bowel movement. Intestinal gas after surgery is normal, and it may be painful, particularly with your incision. Walking is the best thing you can do for gas pain and bowel function. Most patients have had their first walk after surgery before they have their first bowel movement. Please call for assistance when you need to use the toilet for the first time. Discharge. Everyone always wants to know when they can go home. Your expected discharge date is on your communications board. Recovery is a gradual process, minute to minute, hour to hour, day to day. In general, you will be discharged when you are walking, your pain is controlled, and you're able to drink and eat. Your IV and any unnecessary drains will be removed before you leave. We are here for you. We have made so many advances in surgery, many of them pioneered here at Hopkins, and all of us are here to make you as comfortable as possible after your surgery. Please don't be shy with your questions or requests for help. Our patient-centered care team is dedicated to you and your recovery.